Hydranencephaly. It is a rare encephalopathy that occurs in utero, so like inside the uterus. Hydra, hydranencephaly, we're going to split the word. Hydra is water, anen means not present. Encephaly is brain, which is mainly the cerebrum. So in this disease, let's see what is actually meant by hydranencephaly. Hydranencephaly is characterized by destruction of the cerebral hemispheres, which is basically the cerebrum, which is hydranencephaly. So, like the cephaly is the cerebral hemispheres, they are absent. Okay, not absent, but like characterized by destruction of the cerebral hemispheres with transformation of the same into a membranous sac containing CSF, which is the cerebrospinal fluid, and the remnants of the cortex and the white matter are present. The midbrain and the brainstem are relatively intact. Midbrain and the brainstem are relatively intact. Yep. And the cause of hydranencephaly is unknown, but bilateral occlusion of the internal carotid artery during early fetal development would explain most of the pathological abnormalities. So the reason as such, we don't know the reason, but one could just come up with a reason saying both sides, right and left internal carotid artery is going to be occluded. So like bilateral occlusion of the ICA during early fetal life, there could be a problem that can cause hydranencephaly as well. A point about the head size, the affected infants may have a normal head or a enlarged head circumference at birth. It grows at an excessive rate postnatally. So the rate of growth of the head is going to be very high after birth. And then we do a test, it's called the transillumination test. It shows an absence of cerebral hemispheres. So like usually this test is done in hydrocele, like whenever there is a, okay, like a just think scrotum is like a water balloon. So you put the torch on top of the skin of the scrotum and we see like whether it's red in color and stuff. So that is yeah, so that is transillumination test. The transillumination test over here is done in the brain. Like in the head, we just put the torch in the head and see. It shows absence of cerebral hemispheres. Clinical features, the child does not have any brain. So it has little or no cognitive development at all. And there is no brain, so it does not know how to feed properly, and the child is irritable, and then it develops seizures. And because like cerebrum is part of the upper motor neuron, so there will be spastic quadriplegia which is happening. Okay, so that is about the clinical features. Poor feeding, irritable, little or no cognitive development because there is no brain, seizures, and spastic quadriplegia, so like all four limbs are screwed up. Treatment is VP shunt, which is nothing but the ventriculoperitoneal shunt. It prevents massive enlargement of the cranium. Massive enlargement of the cranium in case of VP shunt. Yeah. So அப்படியே தலை பெருசாயிட்டே போகும். So just to prevent it, we put a shunt. We connect the ventricles of the brain to the peritoneum of the abdomen. And then there is a similar condition similar to hydranencephaly, which is called porencephaly. It is considered as a less severe degree of the same pathology. So that is about hydranencephaly. As a quick recap, where does it occur? The problem starts in utero. So like inside the uterus, what is the problem? The cerebral hemispheres are replaced by membranes, and it basically looks like a sac which contains CSF. And what is it due to? The cause is unknown, but we can come up with the cause. Say that both sides, right and left internal carotid artery is occluded, was occluded during development of the brain. So that's the problem. And what about the head size? The head size can be normal, it can be very large. And then the test which we do is transillumination test, and clinical features we already know. The main thing is the quadriplegia. Treatment is VP shunt. Milder form of the same disease is porencephaly. Thank you.